type into the chat. I would love to know. And the screen that you are looking at is called The 5 Mistakes Moms Make After C-Sections That Could Have Saved Them Years of Pain. Cool. Awesome. All right. Lovely. Thank you, guys. So let's get started. So this webinar is going to focus, I'm going to tell you guys a story, kind of the common soliloquy of events that I see moms go through when they don't address healing the C-section right after delivery. So we'll kind of talk through some case studies, and I'll tell you what happens down the line after common things that happen after C-sections. And then we're going to talk about some anatomy. So I'll show you all about the core and what that consists of and how it's affected after a C-section. And then we'll go through the 5 mistakes. We'll talk about some common issues after C-section, and then how to heal and really your next step to what should be happening there. So cool. So I am going to start with a little story about a patient named Leah. So Leah is a mom who was 45 when she started coming to body motion, and she had a C-section in her early 30s. I don't remember the exact age. So one child, she is now, her kiddo is now 13, and she had excruciating sciatic pain and had gone to regular physical therapy to try to alleviate that pain, and it just, nothing was working. So she finally read one of our stories and realized that it could be tied to her C-section scar. So she started coming to body motion, and after just releasing her abdominal wall, her scar tissue, getting her organs moving, normalizing her core, and retraining everything, she was able to get rid of her sciatic pain, and it really didn't take too long. And so and she was dealing with this for years. And what also came with this is really commonly what I see with a lot of women who have C-sections that may not have issues right away, but show up with things down the line. You see women have, like after 10 years after C-section, you might experience significant severity in menstrual cramps. So menstrual cramps become a lot more painful than they ever used to be. And that's actually common after C-section. So your cramps in your menstrual cycle might feel more intense after your C-section than they did before you even ever had kids. So that's one of the symptoms that pleasantly got to get resolved with Leah. And another thing is intercourse. So when she came here, she didn't mention intercourse was uncomfortable. When asked about it, didn't say anything, said it was fine. And about a month into therapy, she was like, her sex life had completely changed. So she didn't realize that sex was actually affected. And this is what we see a lot. So until something brings you in like a severe sciatic pain that you can't walk, then you end up dealing with that, and all these other things get better that you didn't realize that you were dealing with. So that's Leah's story, and I see it in so many women, and that's why I'm sharing the story, because we end up getting a lot of moms in their mid-40s who have severe cramping, severe menstrual cramping, or maybe they've just always had an SI problem. So an SI joint is the joint on the back of your pelvis. So some people, I'll stand up here. So some people show this as like pain in the butt, just on one side of the low back or right above the butt. And that would be your SI pain. So that can be all related to the C-section. So let's go on to the next story. So I guess we're on to anatomy. Hopefully y'all can see that. So what I have here is a diagram of your core muscles. So we have pelvic floor muscles at the bottom. I want you guys to all look at the side view right now. And then your front muscles is a piece of your abdominal wall, your transverse abdominis. Then you have these little muscles on the back. So the names are irrelevant. The diaphragm is important. So these are the important muscles. So it doesn't matter what you call them. When you cut them, you effectively break the effectiveness of how strong the core is. Also, simply just growing a baby and expanding these muscles and then having the baby can make a problem in your core as well. So this isn't just C-section specific, but it is when you cut the muscle and then you have scar tissue in it, it kind of amplifies the effect of weakening your core. And so I'm going to show an example. I think I'll leave this up here. So this is your muscle. This is what we are going to call the core. Okay. So I have a pop can here. I guess this is the next slide here. I have a pop can. Oops, nope, this is this slide. So I have a pop can here, and the front, imagine that each muscle is part of the can, okay? This is a pressure system. So if I tried to squish my can right now, you couldn't do it because there's a hole and there's good pressure in it. So our core has this amazing pressure inside of it, and that pressure helps us absorb different forces. So if you go for a run, you'll be able to absorb the forces so you don't wear out your joints. You'll be able to hold your organs inside your body because you have a good pressure system. And your core, that's how your core is strong, is because you have this good pressure system. The minute you have surgery, so any abdominal surgery, we're talking C-sections here, but this counts for a gallbladder surgery, this counts for appendicitis, a cyst removal, a hernia repair, you name it, this counts as an abdominal surgery, which is going to affect the pressure system. So when that happens, it's like opening the soda can, and then all of a sudden, the pressure in the soda can makes it so I can easily squish this can. So unless that pressure system is restored, so unless you heal the C-section scar and heal the patterns of the muscles and the pressure system, then you will always be like wearing out your joints just a little bit more. And I'm going to take a sip of this because why not? And I'm thirsty. So so that is what the core is. So I'd show the pop can analogy. I didn't make this up. A physical therapist named Mary Massery did. And it's just a great way to show that your system needs to have pressure in it. So now we'll talk about what happens when that pressure system has a big scar in it. And that scar would be your C-section scar. So I'm going to go back here. So if you guys look at the other picture here, the muscle picture, what you see is that there's multiple layers of muscles. So when you have a C-section, you effectively cut through 7 layers of tissue. And so you have skin being one, and then you have your fascia, so that's underneath the skin. That's like if you imagine wearing a bathing suit or a unisuit, that would be what the fascia is. So it encompasses all the muscles and the organs. Then you have the organ layer, and then you have more fascia and more organs. So you cut through 7 layers. So when I'm talking about scars, I'm just going to talk about skin, muscles, fascia, and organs. And all 4 of those are affected through C-section. And so if you ever like hear that like you need to mobilize your scar or massage your scar, that's super good, super important, but it's just a piece of it because all you're doing is effectively moving the superficial layer, so the first layer of skin. And what I also want to tell you is that a healthy, happy scar, for the superficial layers, you should be able to pick it up, move it up and down, side to side, and it would not pucker. So it would just move like the rest of your skin. Hopefully you can see that. So it would move like that. If it's not a healthy scar, it's adhered. You can't just pick it up. There's a, let's see, there's a divot in there. Can you see that? Like a divot? You don't want the scar to look like that because that, some people will explain that as like giving you the muffin top. You might have a muffin top on top of the scar. And so getting that to move around and really messing with that tissue can help break it up. Does that make sense? Anyone want to engage with me in the chat so I know that I'm not staring at myself? But if anyone has questions on how the scar should move, drop it into the chart. Okay, makes sense, Erica. Yeah. So, and again, any abdominal scar, you want to have that kind of movement. So, but a piece of the puzzle is that that's just the superficial scars. So a bigger piece, and we'll get into it a little later, is that you need everything mobile. So you need the organs to also move. When I mentioned earlier that people get really bad menstrual cramps about 10 years after C-sections, a lot of that is because the organ is frozen because of the scar tissue within the organ. The organ freezes, and then you have to, during menstruation, the uterus actually contracts to slough the lining. And so it almost has to over contract because that scar is within the uterus. So, so it can cause actually heavy bleeding as well. A lot of people with C-sections end up having what they call uterine ablations because they bleed so frequently and so much after they are kind of premenopausal age. And a lot of that is simply because they never really dealt with the scar tissue. Now, there's tons of other reasons as well. So I'm just giving you the one example of how a C-section scar can actually impact that organ mobility and why it's important to do that. So I went a little deeper on this slide than I thought to. So I'm going to go into the mistakes. And I want to read the chat here for a second because this is fantastic. Thank you guys for engaging. So I had hernia. I can't even talk. I had a hernia surgery in July, and getting movement to that area helped. Yeah, definitely. How long after surgery are you able to massage the scar? Once it's completely adhered, so there's no openings, and everything is attached. So typically 6 weeks, and that's when you will see your OB, 6 to 8 weeks, and it's mainly due to the tissue healing. So if you have any area that's open, you would not touch it. You would not want to start massaging it, but massage and touch, the sooner the better. So as long as it's closed, you can start touching it. And there can be a ton of emotion wrapped up into just touching your scar, and it might be because you had the C-section that you did not plan to have your child that way, and so you might have emotion wrap up to that, and a lot of women do, and that is okay and understandable, and it's healthy to be able to start to touch your scar and to heal it that way. And if you feel like you can't do that yourself, definitely getting to a pelvic expert physical therapist will help navigate that with you, and really help get that moving. Okay, I am going back to the chat here. So 6 to 8 weeks, as long as the scar is fully adhered, that would be when you start to massage it. Yeah, so I believe those are the questions. Let me go all the way down. Cool. Okay, what about impact for subsequent or second C-sections? Yeah, I think I answered that in just a little bit, Kim. So if I don't touch that, will you just message that again into the chat? But I am going to talk about that as far as preparing maybe for a VBAC or just preparing for another pregnancy in general. And so, cool. Let's move on to the next slide. Okay. So mistake number one that we see people make a lot is believing that they can go back to the gym or do their exercise classes to start rebuilding your core. And so when I say core, I'm talking about all the muscles that we just looked at. And what we know is that just starting to do crunches or planks is not what needs to happen in order to rebuild your core effectively and to have good core control. So the muscles that we were looking at in the abdominal wall, they sit right here, and when they're cut, they need not only scar releasing, but they need to be retrained, and then they need to be coordinated with the pelvic floor. So going to the gym and busting out planks and crunches are not necessarily going to activate the right muscles. So learning how to effectively relax your pelvic floor and also engage your lower abdominals is extremely important after a C-section. And it's really, really hard to do on your own. And I will just tell you that if you had an ACL surgery and you would go to a physical therapist to get your muscles retrained to support your knee, and that absolutely needs to be the case after a C-section. They don't just come back for you. And I've never seen a case that actually happens. So if you had really good control and awareness of the core before, it's easier to get it back after, but there definitely needs to be retraining involved, because when you cut the tissue and you cut the muscle, you effectively cut the nerves to that muscle. And so it becomes kind of dumb and it just doesn't work as well. I can't think of a better word to say, but so that's really essential in rebuilding your core before you just go bust out a bunch of crunches. So that's mistake number one. Mistake number two that we see a lot is we see a lot of moms, and you might even have felt this way when you were pregnant, and a lot of moms will disclose this to us as well, is that they think they've spared their pelvic floor because they had a C-section. And so I am going to tell you that is not the case. So I briefly mentioned that unisuit or wearing a leotard I'm going to stand up to show you this. And so when you have your C-section, if you imagine I'm in a full body one piece, okay? And then I cut right here to get to the uterus and pull the baby out. So I am going to pull all this together and it's going to scar down. What effectively happens with that is my pelvic floor will lift. The fascial layer within the pelvic floor, you will see elevation. And so what ends up happening, we see a lot of what we call hypertonic pelvic floors. These are pelvic floors that live in a more contracted state and don't have the ability to relax. And then when that happens and you have a contracted pelvic floor, you can have pelvic pain, you can have pain with intercourse, difficulty orgasming, unable to tolerate penetration, incontinence, a whole host of things. And so your pelvic floor is really affected after your C-section. So if you have been to a physical therapist after your C-section, that's amazing. But all the more you need to really get your pelvic floor checked as well, especially if you're hoping to have a VBAC. And so one of the things that preparing for a VBAC, you want to make sure that you have that full range of motion of your pelvic floor. And so that it can contract, relax, and bulge. And that's part of the core, that's part of the force absorber. And it's really important in healing after the C-section. And so does that make sense to people? Did I explain that clearly enough? Sometimes I get lost in my own descriptions. So you guys want to drop into the chat? Anyone have questions on that? Okay, cool. Understood. Yeah, cool. Okay. Great. So pelvic floor is affected. There is no saving your pelvic floor, especially what we see a lot is a lot of first-time C-sections end up being emergency C-sections. So you might have pushed some, or the baby spent a lot of time right inside your pelvis. So the pelvic floor took a ton of pressure anyways. And so you might even have some scarring and some micro tears within the pelvic floor as well. And so, just because there was a C-section doesn't mean there wasn't vaginal pelvic floor implications. So it's just important to keep that in mind. Cool. Our next slide here. Okay, mistake number 3. You don't have any issues, so you must be totally fine. We see this all the time. This is like oh no, it snuck ahead. This is like the Leah story. So I told you about Leah. She had the baby and came to us in her mid-40s, and she was fine after she had a C-section. I mean, she wasn't fine. She was cut open, and she was told to go home and don't bend, lift, or twist. And then at 6 to 8 weeks, she was just like magically ready to hit the gym again. And unfortunately, then we think we're fine, and maybe after 3 months or so, you feel better because you aren't so close to the surgery, but you are still so affected. And it's just really important to have that awareness, have that knowledge that even though you feel okay, that your muscles still may not be working for you, and your core still might not be working for you in the way that it should to support your joints, support your pelvic organs, and really be firing for you. So just because you don't have issues now doesn't mean that you won't in the future. So it's like the ACL rehab. Like you could tear your ACL and maybe you don't go to as much physical therapy as you need, but you're always going to maybe have a little bit of a limp, or you might not be able to play soccer again because it just doesn't feel right and it's unstable. And so just because you feel okay after your C-section doesn't mean that your core is okay. And so in this country in the future, it'll be funny watching this in 20 years when this is actually standard practice. I'm just putting that out to the universe, because everyone deserves, after a C-section, after any baby, no matter how it's delivered, deserves to have pelvic floor rehabilitation, but especially after a C-section. So it's a major abdominal surgery and a lot of things are cut and they need to be recoordinated. So getting repetitive here, so I'll move on. So mistake number 4 is waiting to address these issues after you are done having kids. So whether that's So you might have had a C-section and you're prepping for another C-section. Maybe the doctor told you that you aren't able to have a vaginal delivery and you always need to have C-sections, or maybe you've decided personally that you don't want to try for a VBAC. No matter what, it's really important to address the scar tissue and address healing after you have your C-section, even if it's 2 years later, even if it's 5 years later, even if it's 20 years later. And within the childbearing years, if you are going to get pregnant again, I almost said knocked up because yeah, that's how I roll. But if you are going to have another pregnancy and you are so if you are planning that, you want to get your scar tissue released and get your pelvic floor and core re-coordinated and worked on with the pelvic floor PT, because of the fact that your uterus will have a scar in it, and a lot of people will end up experiencing C-section type pain, so pain along the scar while they're growing another baby. So while the fetus is growing, because of the expansion of the scar tissue, can be so incredibly painful. And we've actually seen people be put on bed rest because the pain was so bad from the scar tissue. And so it's a good idea to get that scar tissue taken care of between kids, and go from there. So that's what we recommend. And if you decide to wait till you're done having kids, it's good too. But we really recommend for the sake of comfort during the next pregnancy as well, and for your core to be working for you the most effectively during your next pregnancy. And I guess I'll touch on a VBAC here. Oops. I'll touch on a VBAC here. So if you are prepping to have a VBAC, is anyone on this webinar prepping for a VBAC or want to have a VBAC in the future? Maybe. If anyone here is prepping for VBAC, one of the things that you really want to make sure of is that your pelvic floor unhooks almost, so that leotard doesn't get so pulled up and you can effectively kind of release it so that pelvic floor can open and release. Because if you are having a VBAC, that's what you'll need to have happen. Your pelvic floor will have to be able to open and expand for that second delivery or third or fourth. So that's really important. Cool. Oh, thanks for sharing, Jenna. That's awesome. Thank you. Good luck if you do. Okay, mistake number 5, starting an intense workout routine right away because you want to. Maybe some of you have already made this mistake. I sure made this mistake after my first child. And so like the pressure is on, right? You just had a baby and you want to get your body back in whatever the industry sells you, that you have to do. So really for me, and like what I would love the language to be is like, you want to get your core back, and that core can happen at any size. You just want your core to start functioning again. So and that's like the most important piece. So when we hit the gym really hard and we start doing plyometrics or running at 6 weeks, 8 weeks, 12 weeks, and your core isn't working for you, 2 years, and your core is not working for you, and you had the C-section, we end up seeing other things happen. Pelvic organ prolapse can happen, incontinence can happen. And so the reason we don't want to just jump into that is because then you end up with more of the like wearing out your joint situation, because you don't have your shock absorber system, because your core never got to kick back on for you. So those are some of the common mistakes that we see. Other things we see after C-section, and again, this is not necessarily 2 months after C-section. This can be 6 years. This can be 16 years. A lot of women, I'm going to go on a side note, but when your core is not absorbing forces for you, a lot of women ended up like having a painful hip and then go through a course of therapy, physical therapy, and then that hip pain comes back because they never got to the root cause of adjusting the C-section or helping the C-section heal, helping the pelvic floor heal, and then that joint ends up being replaced, and then you end up wearing out another joint. So that's kind of like the soliloquy of trading pains without getting to the root cause. And so that's just what we see C-section moms end up with, because they don't get that information and don't get that knowledge to restore their cores. So that was a tangent, but so things that happen, pain in the scar, again, can happen at 2 weeks, can happen at 2 years. Constipation, So constipation is very, very common because not only during pregnancy, so pregnancy, you grow a fetus, okay? Your colon is right here. I hope you can see me, but if you can't see me, you can just drop it in the chart. So your colon is right here. During pregnancy, as you expand, the fetus then effectively moves the organ, the whole colon, out of the way. Okay, so the colon gets compressed and out here. So constipation during pregnancy is very common. And then if you have a C-section, you effectively have this scar here. The baby comes out of here and everything gets scarred down. Well, this is called endopelvic fascia. You just think about it as a fancy sheet that encapsulates the colon. Is also the same tissue that encapsulates the uterus. So now I have scar tissue in the uterus, and that's pulling on the colon as well. And now but the colon's still like stuck and frozen out here. So a lot of times the stool just doesn't have the same transit time, and so you get constipation. You might get bloating. I'm going to take it a step further. This can be even more exacerbated because your pelvic floor is so tight. So the pressure within the abdominals is just so much. So those are common things during C-section, like after C-section, that can happen within the belly. And so when I brought up pressure again, so that pressure system, too much pressure is going to affect the ability of the core to work and fire. If your colon is really stretched out, it actually makes it even harder for your core muscles to come back and start working at their normal lengths. So that was a lot. Who has questions about that? Let's see. Ami said, that might be explaining why your knees are uncomfortable. For sure, yeah. If your pelvic floor and your core muscles aren't firing together and aren't absorbing the forces, it puts a lot greater toll on the rest of your joints. Is yoga included in C-section workout after, is yoga included in working out after C-section? I don't know what that means really. Let me see, yoga. Jenna, do you wanna ask me, be more specific? So yoga after C-section, yoga in general, when you perform yoga appropriately, you are activating and stabilizing the movement. And so you want your core working for you. So I would include yoga as part of a postpartum exercise routine where you want your core working for you. Is yoga different than working out? I would say like you need your core for yoga, no matter what, especially if you have a lot of flexibility in your joints, which a lot of postpartum women have more instability and flexibility in their joints. So they need that core even more. So I would say it's not necessarily bad, but for yoga to be the most effective and beneficial, you want your core working for you. Hopefully that answers your question. When is it safe to start working on yoga? Well, unfortunately, like the research in your doctor will say 6 to 8 weeks, right? And that's pretty much just when you stop bleeding, the locatia stops coming out. But in all reality, like that yoga and working out should be a graded routine, and it should be graded based on how much your core is firing for you and working for you and stabilizing your skeleton. That's not the answer you wanted to hear. But like to safely go back to yoga, that's what you'd want to have happen. Now, do most people get that opportunity? No. But should they? Yes. So obviously I'm biased, but I see it all. How do you tell if your core is properly working? That's a good question. So a pelvic expert physical therapist would absolutely be able to tell you this. So they would be able to tell you, so a healthy core, I'll start at the pelvic floor. The pelvic floor contracts, so you could feel your, you would feel your vagina close. You want to feel it open, and then you have to feel it bear down, so expand, okay? So you have 3 positions of the pelvic floor. The lower abdominal muscle is between your 2 hip bones, and what it looks like when that contracts is you would feel a firming underneath your fingers. So if you put your hands, I'm like scared to move my computer here, but if you put your hands right inside your hip bones, you will feel like a little bit of a lift and firming, and then that's your lower abdominal muscles. And then for your diaphragm to be working, you have to be able to take a nice deep breath into your belly and let it go. So if you put your hands on your belly, you should be able to keep your chest relaxed and then just pull the air down into the belly. And after pregnancy, this is really hard because your ribs are still flared, so your diaphragm is expanded, and it's difficult to drive the diaphragm into the belly. So you have to start regaining strength that way. And then you have these muscles on your back and your butt, your multifidi muscles on the back, and they have to be able to stabilize you. So as you move, like if I was gonna do a little march, I have to be able to hold this, my body not move, and be able to lift a limb. So if I was unstable and not doing it correctly, I'd be dropping a little bit. So that would be the back muscles. So that's like the series of events of how you would really check to see if your core was strong. Does that help you? Let me know if that is clear. It's kind of a lot. We recorded this, so you guys will all have a replay of it. Okay, cool. So how soon can you be checked post C-section? Really, after you're cleared by your surgeon that the stitches are, or that your scar is completely adhered, there's no openings, then you can be checked. So typically 6 to 8 weeks when the tissue is healed. Yes, good question, Carly. Okay, cool. So yeah, knee pain, recurrent muscle strains. We see a lot of ankle sprains and strains just because after C-section, because your core is not working, so you have an inability to stabilize. So you might roll your ankle more. You also have more looseness in your joints, so things are less stable. So back pain, hip pain, shoulder pain, that's all can happen after C-sections. So how to heal, of course. So see an expert PT, someone near you. Come to us if you're in Washington. We'd love to help you. And really, so healing is a process. And let me see if that's on the next slide. Yeah, so really step one, we identify the issue. So we find out all the layers of the scar. So just doing scar massage on the skin is not enough. You have to do scar massage on every layer and get your uterus moving, because the uterus moves and floats in your body just like the rest of your organs and your colon. And a lot of time after any abdominal surgery, like I said, the organs kind of freeze and they stop moving, so that then they don't function as well. So part of restoring the scar tissue is just also restoring the mobility of the organs, which then will help with the menstruation and it will help normalize your bowel movements as well. And then dealing with the scar tissue and the tone of the pelvic floor. So one of the ways we do this is by releasing the tissue. And then we teach the muscles how to retrain. So releasing the scars, releasing adhesions in the muscles, normalizing muscle length, so allowing the pelvic floor to go back to its normal position, is all part of it, and that's done with hands-on work. And some of it you can do yourself. A lot of it you can help facilitate the process. It's just your own comfort level on touching yourself. Can you do these things while pregnant? Some of them, yes. Or just wait to heal from the next C-section. No, Diana, you would want to do this while pregnant, because depending on how your pregnancy is going, it can help with your back pain, it can help with hip pain, and if you are preparing for a VBAC, these would be things that you want to address during the pregnancy. And then Kim said, this may explain why intercourse has never been the same after my C-section, even after seeing several OBs and medication. Yeah, they love to. Estrogen cream, that's what everyone gets. Sorry to say that, Kim, that's not fair, but that's what, like, for some reason, that's the answer. And they do that because they assume it's because of vaginal dryness, because your hormones after a baby are a little wonky. And if you're breastfeeding, your estrogen levels still don't come up. So then they'll just automatically give you an estrogen cream. And unfortunately, that's not 99% of the time not getting to the root cause of what's causing the pain with intercourse, or the inability to have intercourse, or the inability to have an orgasm. So it is really important that these muscles are addressed, because they are what can effectively help you have pain-free intercourse and enjoyable intercourse, because that's part of what you'll want, what a lot of people want to be able to enjoy as they age. One analogy I'm gonna throw in, and then I'll go through the rest of this, but is a lot of times post C-section, moms end up with this really tight pelvic floor. And if you were on our pregnant body workshop, you would have heard me say this as well. What a really common thing that ends up happening when the pelvic floor is so tight is it gets a texture like it's beef jerky. And I don't mean to give this a food analogy, and I'm sorry if it's too much for you, but the pelvic floor like effectively feels like a dried muscle because it's so contracted and just not healthy and doesn't have the ability to contract, relax, and bulge. So you end up with this texture and it literally feels like beef jerky. And so a healthy, happy pelvic floor does the contraction, relaxation, and bulge, but also feels like a juicy steak or like a nice piece of meat and muscle because it's a muscle. And so so that's what we see a lot is like at that the post C-section, and sometimes it's many years post C-section, we see that like dried beef jerky feeling. And that kind of makes sense that like, of course, intercourse doesn't feel comfortable if the muscle has a texture like beef jerky. We want it to feel soft and pillowy and work that way too. So I'm talking a little bit about the quality of the muscle. And I think for me, it's easy to describe that, and it's like a better visual than just saying it's tight, because a lot of times it almost dehydrates because it's just not getting the blood flow, because the C-section scar has lifted it up. And there's more reasons for it too. I'm just not going to go into all the reasons, but effectively that's what we see. Could this also impact labor progression for VBAC? Well, I don't have exact research to say that because there's really not any research on the quality of pelvic floor muscle and VBAC success, but it is my dream to do research on this because we see huge, huge, huge effects on the ability of healing your pelvic floor, training your pelvic floor for delivery, especially for VBACs, because you have old injury. The C-section scar is an injury, so you have old injury that just hasn't been healed, and so it can have a huge drastic effect on helping you be prepared to push a baby out. Let's see. Hopefully that answered your question there. And then are you going to talk about stretches or exercises that we could do to restore the core? Yeah, I'll give you a couple, and a couple will be just repeat. So we'll talk about that. We're almost done here. So the next step would be retraining those muscles. So getting those muscles to coordinate together. And then rebuilding your body. So then really starting the strengthening process. This is the hit the gym phase. This is the try your favorite exercise class phase. And then maintenance is just keeping those tissues healthy, keeping them functioning. And then some people find that as they really push their body, maybe with like training for new things, they might end up with like those same patterns of like tightness again. And so that might be when you go back and get more scar work or more pelvic floor work. But doing it originally helps a ton of the time, especially if you stay up on keeping your core coordinated. And once you know how to do it, it's a lot easier. So that is the end of my PowerPoint. But Jenna, I want to just say, like, it is super specific as far as like getting your core coordinated. So for me to like specifically give you exercises, the first exercise that I want everyone to be able to do is to do the nice belly breathing. You might think like, how is breathing exercise? But it's truly getting your diaphragm to pull into your belly and doing breaths in that way. So getting expansion through the belly, getting the diaphragm to drop down, and being able to do a belly breath is the first step to getting your the top piece of your core, so the top of the pop can. And then what needs to happen is your pelvic floor needs to follow that. So one of the things that we teach is to try to get your breath on the inhale to also open your vagina. So you get this opening because the diaphragm descends into your belly. The pelvic floor should also open. So breathing is actually an exercise, and that is the first exercise that you should start to do. And really, that's safe to do right away after you have a baby, after a C-section or a vaginal delivery. And so that'd be the first thing that needs to happen, is that breath pattern. The second thing that needs to happen is getting your lower abdominals to fire. So putting your hands underneath right by your hip bones and feeling like you can lift your bladder or lift your pubic bone. If you know where your pubic bone is, like right above your vulva, and you imagine kind of lifting up that area, you can see if you can get your lower abdominals to fire. This shouldn't feel like a full-on bracing So that would be like if someone's trying to punch you, you might brace your body so that you have like this rock solid core. We're just trying to get the lower abdominal muscle to firm. So you would feel firming underneath your fingers. And so that would be the next step in as far as like rebuilding your core and a specific exercise to do. Jenna, does that help? You're like, I want more. I'm sure, and I want to give you more, but it's really specific to where you are. And if you don't have those two pieces done correctly, it's hard to build off of that. And so people go years hitting back the gym and doing all the things, and then what happens is you end up getting years of compensation because other muscles start working for you, and that's why you get the hip pain, or that's why incontinence comes on, is because your body can only compensate for so long using the wrong muscles. And so retraining everything to work correctly and in unison. Yes, I'm a nurse and a yoga teacher, so I totally understand. Okay, cool. Awesome. Nice. That's a good combo. Sweet. So I want to open the floor. We will stop recording in just a second. And I would love if anyone wants to jump on and ask me specific questions about their journey, or Devin dropped in the chart. We do offer a free discovery visit. So if you are thinking about wanting to work with us specifically, we're happy to talk with you, and we'll do a consultation and kind of see if we're the right fit for you and really helping you on your journey to feeling your absolute best. So I am going to stop this share here. If I can figure that out. Cool. And then Devin, do you want to stop the recording?